Hello, my name is Morgan O'Brien and I am an RN currently residing and practicing in Texas. I decided to do this YouTube to educate people on what a directive to physicians and family or surrogates is. I will explain how to fill out the form, which is easy to do, and then have it properly executed. Going forward, I will simply refer to it as the directive to physicians, by which it is commonly called. It is often referred to as a living will, and one should not confuse it with a will and last testament. On initial review, the form appears rather simple-like. It gives the definition as to what irreversible and terminal conditions are and what life-sustaining treatment is. The way the form is constructed, it has a place where you can also list individuals called proxies who can also make decisions for you if you are unable to do so yourself. Generally, people also execute a medical power of attorney along with this document, which is a very advisable thing to do, and in which case one does not need to list proxies on this form. Many times a patient who does not have a directive to physicians will tell me that their loved ones will know what to do when the time comes. This can place a lot of unnecessary burden on some relatives, and what's more, not all relatives may agree on what best to do for you in your final days, resulting in a lot of squabbling. This is all the more reason one should execute a directive to physicians. It is a wise thing to do, and nobody can amend or alter it except the person that signed it. Lastly, I have also come across folks who have executed a will and last testament and taken care of all the funeral pre-need arrangements, yet oddly enough have not executed any medical advance directives at all, and that invites further discussion. A directive to physician gives instructions on how to administer, withhold, or withdraw life-sustaining treatment in the event of a documented terminal or irreversible condition, even when a person has documented incapacity. There is no law that requires a person to have one. It clarifies one's wishes and lessens the burden on loved ones deciding what to do for you if you have a terminal or irreversible condition. A directive to physicians is not to be confused with an out-of-hospital DNR order or healthcare facility DNR consent, whereby a person does not desire